Okay, students, another area that we're going to spend a little bit of time on is feeding baby. Three things that you need to think about before baby comes along is sleeping, feeding, and pooping. So what we're going to be talking about in this lecture is how are you going to feed that baby? How are you going to provide nourishment for that baby? And we're going to look at a couple different things and we're going to talk about it in some detail. All right, for my nursing students out there, one initiative I want you guys to be aware of is the Healthy People 2020. And one of the things that Healthy People 2020 is working on is increasing the rate of breastfeeding. So they've really looked at how maternity wards have addressed breastfeeding. Do they have lactation consultants on staff? This is a pretty hot area right now in nursing. Teaching women how to nurse, teaching women how to breastfeed. It has been an art that has been lost due to the high rates of formula feeding that went on during the 60s and 70s. One of the things that Healthy People has found is that about 74% of mothers breastfeed at birth. So one of the things that Healthy People does, the initiative does, is it surveys women who are in the hospital, and they just ask them, have you breastfed your baby? And if they say yes, they count that as a feeding. So about 74% of women report that they did breastfeed at least one time in the hospital. They survey them again as time goes on, and they find that right around the 6-month mark, you still have about 43% of women nursing their babies. Around the 12-month mark, about 24% still nurse babies. The APA, the American Pediatric Association, recommends that mothers breastfeed their babies exclusively until about 4 months and continue nursing until 12 months. The World Health Organization recommends exclusive breastfeeding until about 4 to 6 months and continued nursing until 2 months. Now, I am going to take the stand here. A lot of people who are taking this class who have children may have used formula or may have used nursing in combination with formula. To me, I think that this is a personal choice. I don't think anything detrimental or harmful is going to happen to your infant if you choose to use formula. However, what the research shows us, and the research is very conclusive on this, is that formula is not as good as nursing. It is not even nearly as good as nursing in terms of delivering the health benefits that breastfeeding can administer to growing infants and also administer to the mother. And what we're going to be doing through the rest of this presentation is trying to tease that out a little bit and talk about it in some detail. So some of the numbers that I want to point out here to you are some of the objectives that Healthy People is looking for by 2020. They want to increase that rate of breastfeeding to about 81%, 82%. In other words, when they survey those new mothers, have you nursed your baby, have you breastfed your baby, they want about 82% of mothers to say yes, that at least that one time they have breastfed that baby. They want to see that number to be close to 60% at 6 months and about 34% at a year. In terms of exclusivity, they'd like to see about 25% of new moms still exclusively breastfeeding their babies by 6 months. And so these are some of the objectives or some of the goals that the Healthy People Initiative has set for itself nationally by the year 2020. And from a professional perspective, for my nursing students out there, if you are thinking about working with new moms, this is a really an area of real growth professionally, having some expertise in lactation consultation. So what I want to point out here, this is a chart that was created by Kelly Mom. So what I want to point out here is this is a chart created by Kelly Mom. Kelly Mom is an organization. It is led and run by nurses. The focus on Kelly Mom is to provide information on breastfeeding. Another really important organization that is also led and run by nurses is La Leche League. So this is a real area in which nurses have taken the lead and been able to help the population in terms of education. One of the critiques of the Healthy People Initiative that Kelly Mom has levied, and also the Leche League, is that the Healthy People Initiative does not tease out the data when looking at the difference between exclusive breastfeeding and just any breastfeeding at all. So if you remember from the last slide, I really wanted to stress that if you reported that you breastfed even one time, they went ahead and considered that a success. And what Kelly Mom argues is that that's not really a success. Breastfeeding one time in the hospital isn't really breastfeeding. That when you want to look at breastfeeding, particularly in the first 3-4 months, the question you want to be asking is really about exclusive breastfeeding, that you are not using formula to supplement how you're going to feed this infant. And when that data gets teased apart, you can see the difference here between the top graphic and the bottom graphic. The top graphic looks at exclusive breastfeeding, and the bottom graphic looks at any breastfeeding at all. And if we just look at 2008 as a comparison, you see here it looks about 70, 72%, 73% have reported any breastfeeding at all. But when we really start to look at it from an exclusive, we can see that it's much, much lower. The other thing that I really want to point out here is this sort of very sharp decline that happens once that infant gets home, that breastfeeding rates drop pretty quickly, particularly between the 3rd and 6th month. So both graphics, you're going to see that right between 3 and 6 months, you're going to see mothers giving up or stopping their nursing relationship with their infant. And the reason why this is because a lot of women go back to work during this time period. They get only so much Family Medical Leave Act, usually 12 weeks. Some women can get 16, depending on what they have saved up. And what will happen is that during that time period, once they go back to work, usually around the 3-month mark, they will still pump at work. The workplace is required to provide a place for women to pump, and they will continue to feed their babies, but they pretty quickly become disenchanted with pumping at work, as anybody would, and so breastfeeding rates start to decline pretty rapidly. So here on this slide, I've got La Leche League listed, and also Kelly Mom. 10steps.org is basically an organization that lists out some current research, but also the steps that need to happen in order for an institution to encourage nursing and breastfeeding from its patients. Some of the positives that go along with breastfeeding is that it really does promote bonding. There's a lot of research. You've heard me talk about attachment theory, and attachment theory really argues for the importance of nursing between mothers and their children. One of the things that we know from a research perspective is that breastfeeding is the exact right distance for infants to be able to see their mother's faces. And I just love this image here because this little guy, he's not just nursing, but he's really looking at mama like, oh, yeah, this is my mom. This is mama right here. The breast milk itself is ideally suited for infants. As infants grow and change, amazingly, the breast milk changes. So when you have a newborn, mama is producing colostrum. The colostrum itself provides the foundation for the stomach and for the intestinal tract. There is nothing that man can make that's comparable to that. And that it really provides the foundation for children to be able to go on and to digest. As the infant grows, the composition of the milk becomes thinner and thinner. And as they become toddlers, it's much more watery, much more water-like, and much thinner than it was when they were under 3 months. Once mom's milk comes in, so usually you're going to get colostrum first, and baby's stomach, when they're newborns, they're very tiny, generally about the size of a marble, one of those large shooter marbles. Are very, very little. Women don't produce lots of colostrum. Baby only needs a couple teaspoons. Once the milk comes in, the milk is very, very heavy, very, very fatty, and it remains that way really for the first 2 or 3 months. And then it starts to slowly thin out as baby gets older. Okay, students, this slide here has a chart that helps us to nutritionally compare breast milk with formula. First thing, I'm not going to read the entire chart to you, but there are a couple things that I do want to point out. The first is the differences in terms of fats. The fats in breast milk are rich in omega-3s, primarily DHA. Some formulas now are trying to add DHA in order to compensate, but the fact of the matter is that it happens in breast milk naturally. It's digested very easily by infants. The other thing I want to point out is that the fats in breast milk change as the infant gets older. They respond to how much fat an infant needs at every point in development. Nearly all the fat in breast milk is absorbed, and it contains lipase. In terms of the proteins in breast milk are very easy to digest. It is very, very rare that you'll see any sort of allergic reaction to breast milk in an infant. That hardly ever happens. Where it's not completely unusual to see an allergic reaction to formula in infants. Formula is basically dehydrated cow's milk. It does have the casein, and the casein is a protein that infants can be allergic to. If an infant does show an allergy to casein, they often switch them to a soy-based formula, and soy is also another common allergen. So this is some of the challenges that you face when you decide if you decide that you're going to formula feed as opposed to breastfeed. In terms of immunity, if there is one reason to choose breastfeeding over formula, this is the reason right here. There is a symbiotic relationship that happens between mothers and their infants. Every time mama touches something or touches infant, if there is a harmful bacteria on that infant or harmful bacteria in the environment, mama's body and mama's immune system produces antibodies. And those antibodies go into the breast milk, and baby drinks the breast milk. And so what happens is that baby inadvertently gets the immunity. You don't get that with formula. There are no live white blood cells, or really any cells in breast milk. It has very, very few immunity benefits, so to speak. Another big thing that happens in breast milk is you see stem cells. There are nearly 100 compounds in breast milk. They have no sense of what they do or why they're there. There has been a sort of explosion on breast milk in terms of research recently, and trying to figure out, well, what exactly is in breast milk. And one of the things that they found was stem cells. This had been research that had been done by a company that sells breast pumps, and they do fund research, and that research discovered that there were live stem cells in breast milk. We don't know why they're there. We don't know what they do, but they are there, and they're there for a reason. In terms of vitamins and minerals, the vitamins and minerals in breast milk are better absorbed, especially the iron, the zinc, and the calcium. You only get about 5 to 10% of absorption in terms of iron from formula. In terms of enzymes and hormones, the enzymes in breast milk are very easy to digest and really help in building an infant's digestive system and digestive tract. The other thing about breast milk is that it varies with mama's diet. So one of the interesting things about breast milk is that if mama eats broccoli, if she eats a little bit of red meat, if she eats yogurt, the infant gets exposed to these things. So if mama eats something that infant is allergic to, what you're going to see in that infant is a very mild reaction, usually some gas or a mild skin rash, as opposed to exposing that infant later on when they're, say, 12 months old to cow's milk, and you get a very strong reaction. They get very sick. Mama realizes that they're not doing well, and they just eliminate that item from the diet. But in addition to that, when mama eats a varied diet that's healthful, the baby benefits from that. For every infant disease, including SIDS, breastfeeding reduces risk. One of the things that we see in babies is they are less likely to develop allergies. If mama eats something, let's just say, for example, dairy, milk, say mom drinks a glass of milk or she eats yogurt, what you'll see on that baby is generally like a small rash or an upset tummy. They have a very mild reaction. And so if baby's having an allergic reaction, mama can take those substances out of her diet and resume breastfeeding again. Typically, the most typical things that children are allergic to is cow's milk. That's one of the most common. Soy is another common. Peanuts, tree nuts, all very common allergens that if baby has a mild reaction, mama can take that out of her diet, as opposed to introducing it later on when that infant becomes a toddler, and the toddler has a much more severe reaction. We are less likely to see asthma in breastfed babies, obesity. One of the things, very interesting study that just very recently came out, they found that formula-fed babies are 2.5 times more likely to develop obesity as opposed to breastfed babies. The longer the babies are breastfed, the longer they are exclusively breastfed, the less likely they are to develop obesity as children and as adults. Colitis, Crohn's, juvenile diabetes, all those things are less likely to develop. I want to spend a couple minutes on colds, flu, and ear infections. You guys, for my online students, you are going to get an assignment that looks at ear infections. And one of the things we know is that breastfed babies as children are less likely to develop ear infections. They're not totally sure why. They think it might be the way that baby is held up against the breast. They think it may also be that with bottle-fed babies, they can't stop the flow of the milk. There's no way for them to stop the feeding the way that there is with breastfed babies. Breastfed babies, if they want to stop eating, they just stop sucking, and the milk doesn't come out anymore. But with bottle-fed, that's not always the case. In addition, you see higher IQs with breastfed babies, better teeth and oral development. They sleep better. And one of the things about breastfed babies, you nurse them, boom, they're asleep. There's a natural chemical in the breast milk, a natural sedative that makes them tired and makes them fall asleep. And in fact, it makes mamas fall asleep too. They have a lot less diaper rash. People that work with infants, one of the things that they'll say is infants that are breastfed, their poops don't stink. Their poops don't stink. And formula-fed babies, stinky poop. Breastfeeding is also better for mama. It saves time, it saves money. You're not fussing with bottles. Going out is very easy. I want to spend a minute on this one. Helps with weight loss. On average, breastfed moms lose about 16 to 17 pounds just from nursing. No change in diet. Usually breastfed moms eat tons and tons of food because they're so hungry and they're making milk, but yet they're still burning lots of calories and losing weight. Helps to space babies. This is an old birth control method, an old school birth control method that women used when they didn't have access to birth control pills or other sorts of birth control methods. They would nurse for as long as they could, sometimes 2 or 3 years, and what it does is it keeps those babies spaced apart. It keeps your estrogen levels in check, and you don't produce the same level of lining, and hence you don't have implantation. Reduces postpartum bleeding. It can reduce the risk of breast cancer. It can lessen osteoporosis, and most recent research indicates that it actually lessens heart disease by about 23%. And this is not from being nursed, but from nursing, that you are nursing a baby. So are there challenges with breastfeeding? Absolutely. The first is that it can be exhausting. So you remember I talked about on the other slide that breast milk has a sedative effect on the infant. Well, it also has a sedative effect. It has the brain releases chemicals that causes mama to be nappy. So after mom's done breastfeeding, a lot of moms feel real tired and they feel like they want to take a nap. Sometimes there are breastfeeding issues that can result, and it requires a real commitment to be able to work through these. Some latch issues, sore nipples. One of the main things, though, is just feeling comfortable with nursing. One of the things is that if you're going to be working with women who have just had a baby, they have to come to see their breasts as something that they use to feed an infant with, that they're not sexualized anymore. And it isn't going to work if you don't really commit to it. So every time that infant wants to nurse, you have to be willing to take the shirt off and and latch that baby on, put the baby on. Really, the only way to ensure that you make enough milk is to latch the baby every time they want to nurse. You cannot rely on bottles. Every time you rely on a bottle, what you're really doing is you're decreasing your own ability to make milk. And so that means you kind of have to get over it. You have to get over the fact that you're going to be spending a large portion of the day without a shirt on. You might get plug ducts or mastitis. Plug ducts, basically sometimes some of the fat from the milk can plug up a duct. It can be incredibly painful. You have to use warm compress, press the milk out. Sometimes women will use a pump in order to release the duct. But really the best advice is to latch the baby on and to nurse through it. And it will hurt. It can be very, very painful. But nothing removes milk from a breast better than a baby. Mastitis, that is an infection of breast tissue. Women that get mastitis, it feels like a flu. They feel exhausted. They feel real achy. Usually an antibiotic will clear that up. Okay, so when do you introduce solids? Usually that introduction happens between 4 to 6 months. When do you do that? Really, what you're looking for are signs of readiness in a baby. Do they hold their head up? Can they sit with a little bit of support? They show interest in food. They grab it. They are interested in seeing what you're eating. They try to put it into their own mouth. A lot of times size is a big indicator. If you have a big babies that are large for their age, 4 months, 5 months, they're maybe the size of a 7-month or 8-month or 9-month-old, are generally ready to move on to solids. So what's the first thing to introduce? Every pediatrician is going to be a little bit different. So for those of you that are interested in working with peds, your pediatrician is going to tell you what their protocol is, and that's what gets communicated to the patient. Generally speaking, most pediatricians start with rice cereal, and the reason is because it has a very low allergic reaction. So what they'll recommend that mama does is that they take that rice cereal and they mix it up with some breast milk or they mix it up with some formula. Once that gets established, generally then pediatricians recommend that you start with veggies and you introduce a new type about every 2 to 3 days. The reason why you wait is to see if there is a reaction. If there's an allergic reaction, you stop, go back to the rice cereal, you wait, and maybe then try to introduce something new. Usually your pediatrician will have you introduce 3, 4, maybe even 5 different vegetables, and then turn around and introduce fruit. Their logic is to introduce the veggie first to get it more established. Now, in fairness, breast milk is very sweet, so there really isn't any sense of it in terms of taste, but a lot of pediatricians usually recommend veggies first. Same protocol with the fruit. Every 2 or 3 days you introduce a new fruit, and then protein, you do that at the end. Some pediatricians, not many, but some pediatricians want to start with protein. And the reason is because there is a very low likelihood of allergic reaction. Very few people are allergic to proteins, allergic to beef, allergic to turkey, and also because the protein has the heme iron. And there's always a concern with infants, particularly there's always a concern with infants in making sure that they get the iron that they need. All right, one of the last things I'm going to talk about is colic. Colic is also known as gas. We have seen a rise in colicky babies. And one theory behind that is the back to sleep program that I'm going to talk about in some detail when we talk about sleeping babies, that it's always best practice to sleep them on their back. So what is colic? Basically, some of the symptoms of colic include distended belly, poop is an odd color, it's kind of a greenish color, a lot of crying, usually starts in the late afternoon or early evening. It peaks around 6 to 8 weeks after the due date, and then it starts to recede. So one of the things that some pediatricians will recommend is that if dad is not going to take any FMLA, then maybe he might want to consider taking a couple weeks, 2 or 3 weeks around the 6 to 8 week mark, because that can be a really, really tough period. No real clear cause for colic. They're not totally sure what causes colic. We do see more of it in formula-fed babies. They have a higher propensity for colic. They think it might have something to do with allergies. In terms of breastfed babies, when we see colic, it can be a slow letdown or a fast letdown. In other words, you latch baby on, but mamas and baby nurses, baby sucks, but the milk doesn't come down right away. So as part of that, they get some air. With a fast letdown, in other words, baby sucks, the milk comes in right away, but there's a lot of it, and they gag and they choke, and you'll see that they sputter. One of the ways to get this addressed is just get a pump. If you have a slow letdown, pump until you start to feel that letdown coming. You stop, you latch baby on. If you have a fast letdown, you pump until you feel the letdown. You continue to pump for a couple minutes to take that sort of that rush of milk out, and then you latch baby on. Bad bottles or bad nipples promote air in baby's stomach. Another theory is too much stimulation, because we've been seeing so much of it in the past 10 years, 15 years, is that we live in a highly electronic world, very noisy, television on all the time, computer on all the time, that it's just too stimulating for babies. They really kind of need to be in more quiet, calm environments. So what do you do if you have a colicky baby? Well, if you're breastfeeding, utilize the pump if you have the above problems, as I mentioned. Gas-X for babies, give it to them a couple hours before the evening, and that can cut down on colic. Vibrating chair. This is a newer invention. It works great. I can go on with much eloquence about how fabulous the vibrating chair is in terms of calming baby down. They're crying because their belly hurts them. You put them in the vibrating chair and you vibrate them away. A baby carrier. So this goes back to what I'd mentioned earlier, this sort of back to sleep program. It used to be that what we did with infants is that we rotated them. In other words, they slept on their back for 1 or 2 nights. We put them on their stomach for 1 or 2 nights. We put them on their back for 1 or 2 nights. And that was done, the thinking was at the time that was done in order to keep their heads from getting flat, keep their heads nice and round. But what the tummy time does is it also pushes the gas out of their stomach. One of the things you have to realize about infants is that they spend a lot of time horizontal. And a lot of our digestion is vertical. It's about us standing up, and that things move down through the digestive system, and they really don't have that luxury. So one way to get this addressed is to get a baby carrier that allows them to spend some time vertically. If you look at women from indigenous cultures or even some third world cultures, they basically strap their infants on them. They carry them, and they carry them vertically. And what that does is that helps with their digestion. You almost hardly ever see colic in cultures that carry their babies. So one of the things that I recommend in order to cut down on colic is to get a baby carrier. I had I believe it was a baby Bjorn, and I would put her in there and just take her outside and take her for a walk for 20-30 minutes. Or you can walk around the house, clean the house. They enjoy it. They like being on you. They like to see new things from a little bit of a different perspective, but it really helps them in terms of colic. The other thing is to do some tummy time with them. roll them over on their stomach, make sure that they're supervised. You want to be watching them, and just let them spend 5-6 minutes on their tummy, and then maybe an hour or two later, roll them back over on their tummy. Again, always supervised, but giving them a little bit of tummy time so that they can push that gas out of the stomach.